I'm Angela Poindexter, one of the integrated marketing managers for Roper St. Francis Healthcare. And we have partnered with Red Hot Mamas to bring you this series on menopause. What I'd like to do is just kind of give you a little background. We've been doing this now since the beginning of the year, I would say around March. This is our last one for the year. And hopefully we will be bringing you some more next year, maybe some of the same topics, and we'll mix in some new topics based on our surveys that you all filled out before the session. So today's topic is osteoporosis and menopause. Before we get started, just a few housekeeping things. We'd like to midway do a little Q&A from the questions that I received from the survey, and then you will be able to send your questions during this time in the chat directly to me. So feel free to ask the questions. I want you to send them directly to me so that your personal name or email address will not be on the screen for others to see. So people a little bit, feel a little bit more comfortable when they know that's not going to happen. So although women go through menopause, it is a process which some live with for years. Sometimes menopause brings with it a long list of possible symptoms. Many women have mild symptoms while others have severe symptoms. Often these are temporary, but occasionally they will last a long time. They affect women both in their personal lives and on their jobs. During menopause, what happens is our estrogen and progesterone levels begin to fall, your bones become thin and less dense, and making you more susceptible to fractures. So we are honored today actually to have two of our OBGYNs. Dr. Wanamaker is on the job in surgery right now, but we have two of our OBGYNs that have graciously stepped in to help us out today, Doctors Higdon and Cisa. So I'll tell you a little bit about them. Let's see, Dr. Paige Cisa is part of our physician partners OBGYN team. She earned her medical degree from the University of South Carolina School of Medicine and completed her residency at Duke University Medical Center. She believes in evidence-based medicine and tailoring treatment plans based on individuals' past experience and personal health goals. She values being able to care for women through every stage of life. Dr. Cisa stays connected with the research in her field and is excited about new technologies to provide the highest level of care. And she has a special interest in high-risk obstetrics, minimally invasive gynecologic surgery, and vaginal surgery. And in her free time, she likes spending time outdoors with her husband and German short-haired pointer. She also enjoys event planning and Clemson football. Now, Dr. Jennifer Higdon, she's also one of the OBGYN with our physician partners, also received her medical degree from the University of South Carolina School of Medicine in Columbia and completed her residency at Prisma Health Midlands. She enjoys caring for women through the stages of life, helping to celebrate joyous occasions and supporting them during difficult times. Dr. Higdon understands the importance of individualized patient care when caring for mothers and their babies. Her special interests are breastfeeding, long-acting reversible contraception, trial of labor after cesarean or vaginal birth. When she's not seeing patients, you'll find Dr. Higdon on the water with her husband, 2 sons, and Labradoodle. She also enjoys traveling and finds mission work fulfilling. So if you will all help me to welcome both Drs. Higdon and Dr. Cisa. You are all ready to go, ladies.
All right, great. Thank you for the introductions. We're kind of just gonna tag team and go through and then pause about halfway through is what we said for questions.
Yes.
So this is just a little overview of what we're going to go over today. Menopause, what you need to know, what it is, what is low bone mass, the life cycle of your bones, how prevalent it is, what risk factors put you at risk for osteoporosis, how do you get tested, how do you prevent it, and then how do you treat it.
So just an overview of menopause in general. There are 3 phases. And the first phase that we think of is perimenopause, which is the time leading up to menopause. It usually begins in your 40s. It often depends on your family history and some other factors. If you still have your uterus and you are still having periods, or sometimes they get irregular, these changes in your body are prompted by hormonal fluctuations, mainly estrogen and progesterone. So many women will start to have kind of here and there having hot flushes and night sweats that are really common. This phase lasts 4 to 8 years before you are officially in menopause. And this is also when you start losing your bone mass. So usually the year or 2 before you're officially in menopause, and then continuing for about 5 or 10 years afterwards.
And so menopause itself kind of comes after that 4 to 8 years of perimenopause. Average age is about 52, but again, like Dr. Cisa was saying, sometimes depends a little bit on your family history. Again, it's when you stop producing the estrogen and progesterone versus just the hormone fluctuations. And in order to be in menopause, you have to have not had a period for a year when you still have a uterus. And then some women might not notice many changes like she was talking about in that perimenopausal state. And some women will continue to have those bothersome symptoms.
And then, this continues into when you're officially in menopause or the postmenopausal stage. Once you officially get that diagnosis of not having periods for a full year, that's what you're in for the rest of your life. For a lot of women, that means about a third of your life you end up being in this postmenopausal state. You no longer get periods, you can't get pregnant, and then you may continue to have some of those bothersome symptoms like hot flashes and night sweats, and then you're more susceptible to some other concerns like vaginal dryness and things like that that can be bothersome, but also can be treated.
So, there are some other things that can put you into menopause other than the normal aging and normal lifestyle or life course, should I say. Medical treatments such as chemo and radiation can put you into menopause, make it happen earlier, or even put you into temporary menopause where you're not having periods for a certain amount of time. And then, like we were saying, the absence of periods is specific to having a uterus. So if we take out your uterus, you may not have periods, but unless your ovaries are gone, so those are taken out surgically, you won't lose your hormones and officially go through menopause.
So the kind of gist of what you need to know about osteoporosis and menopause is that everyone who goes through menopause is going to have lower estrogen levels, which causes bone loss. The rates are highest at the time of menopause when you're actually diagnosed with that. And then a few years before that, you have a small percentage of loss, so about 2%, 1 to 3 years before you go through menopause. And then that continues and lasts for about 5 to 10 years. You will, on average, lose about 10 to 12% of your bone loss in the spine and the hip when you are transitioning into menopause. And then by the time you are 80, you've lost approximately 30% of your peak bone mass.
Osteoporosis is considered a silent disease because a lot of women don't have symptoms associated with it until they have a bone. But about 50% of women over age 50 will break a bone due to osteoporosis or have a loss of height or stoop posture from little vertebral fractures, which can be a sign. And then 80% of American women with 80% of Americans that have osteoporosis are women.
So osteoporosis is a condition where the bones become weak and can break more easily. It really just means porous bone or bones with holes in it. Bone loss is a natural part of aging, but not everyone is going to lose enough bone density to actually develop osteoporosis and become a problem. So there's two definitions that the NIH or National Institutes of Health has for osteoporosis. So you can either have too little bone formation or excessive bone loss, or a combination of both. It's also known as a skeletal disorder that is characterized by compromised bone strength, which makes you at a higher risk of having a fracture. And so the bone strength looks at the density of your bone and also the quality of your bone.
As opposed to low bone mass, which is when your bone density is normal than lower, but is not low enough to be considered osteoporosis. This is also known as osteopenia. And not everyone who has this low bone mass or osteopenia will develop osteoporosis, but it does put you at increased risk. Approximately 48 million Americans over the age of 50 have osteopenia. And those with osteopenia are more likely to break a bone compared to women or people in general with normal bone density. And when you fall into this category, you can see your doctor to evaluate you to see if you need medication to help prevent going into osteoporosis or get you back to a normal bone density.
All right, so our bones are constantly changing. The kind of tricky thing is that 80% of your lifetime bone mass is actually developed by the age of 18. And your peak bone mass usually occurs between 18 and 25. So the more you have at that time in your early 20s, the less likely you are to get osteoporosis or break a bone later in life when you end up losing that bone mass.
So we reach that peak by a balance of bone formation and bone loss, but bone loss can start early, like we were saying, even in your 20s. It's kind of when you're maintaining, but at some point you may start to lose more bone than you're forming. And for most women, bone loss increases after menopause, like we were talking about earlier, in that perimenopausal state up to about 2 years after. And then the 5 to 7 years after menopause, you can lose up to 20% or more of your bone density.
In the US, more than 10.2 million adults ages 50 and older have osteoporosis, and more than 43 million have low bone density, and most of those being women. Approximately half of all women and then a quarter of all men over 50 will break a bone in their lifetime because of this.
68% of those 44 million people are women, like we said. That's the majority. And then 1 in every 2 women over 50 will have an osteoporosis related fracture at some point in their lifetime, which is twice the rate of men, which would be 1 in 4. And 75% of the cases of hip osteoporosis is seen in women.
So let's take a break here and let's get some questions. And I'll start off to give you all some time to think about questions and type them in the chat. Do the 2 questions that we had that came in the pre-survey. For this is the first one is for osteopenia. What exercises to avoid? Your opinion on continuation of HRT, and what about shot/medication with low risk? There's 3 parts to that question. What exercises to avoid? Your opinion on the continuation of HRT, and what about shot or medication with low risk?
Well, so as far as exercises, the best ones that you can be doing are weight strengthening exercises, whether that be with weights or even body weight strengthening exercises. And you want to avoid excessive cardio, but as long as you're doing a mix with the strengthening exercises, it's okay to incorporate that in.
I'd say, like, if there is something that's like a specific exercise that you're concerned about, you can bring that question to your doctor, or if you have like a physical trainer or somebody, they would be also like well versed in like specific exercises that you should not do. But in general, like in moderation, most things are going to be safe as long as you're avoiding super excessive weights and things like that. And then what was the second part of this?
Opinion for continuation of HRT for osteopenia.
So, in general, if you are on HRT, it's safe for you to continue it through the rest of your lifetime, really. And so if it is beneficial for you for symptoms, then it's, then I would continue it. It also is going to help you to maintain some of that, some of your like bone formation and prevent further bone loss. So I would definitely continue it if there wasn't another contraindication.
I will say though that that's typically not the reason that we start HRT, but if you're already on it, it definitely helps prevent further bone loss or helps you maintain your bone mineral density.
Okay, and I think we answered all three parts of that. The question is losing bone mass a natural process of aging? And I think we just answered that one. You want to follow up with some more information on that?
Unfortunately, yes, it is a natural process. So, everything from birth, your bones are consistently changing. And so as you have fluctuations in your hormones throughout your life, that kind of process is stimulated or declines. And so as we age and you have that lower estrogen, you're not making as much bone, and then you end up having more bone loss, and so an overall decrease in the strength and density of your bones.
Okay, those were the only two. Does anyone have any? I don't have any chat questions, so we're going to move forward. If you think of something as we are finishing out, just go ahead and put it in the chat, and I will definitely read it towards the end. Okay, ready to go.
All right, thank you. So in thinking about if you are someone who is at risk for excess bone loss, these are some of the things, and we talked about a lot gender already. So all women, you're automatically going to be at a higher risk of having osteopenia or osteoporosis. As we age, that's going to increase your risk as well for that decrease in estrogen. And then your body size also plays a factor. So petite and very thin women are going to be at a greater risk of having excessive bone loss.
Ethnicity, white and Asian women have increased risk of getting osteoporosis than Black or Hispanic women. Your family history, so if there are women in your family who have history of osteoporosis, that puts you at a higher risk. And then declining hormones, which is why specifically menopause puts you at higher risk for osteoporosis, because you have low estrogen levels, which puts you as a woman at increased risk when you go through menopause.
Some other things to consider are your diet. A diet that's low in calcium and vitamin D is going to make you more prone to bone loss, because you don't have the things that you need to build that stronger bone. Your activity level. So if you have a job where you're not very active, or you're not exercising outside of work, or if you have some health conditions where you are on long-term bed rest and things like that, that can cause a weakening of your bones. And then some medications can also increase your risk.
Smoking increases your risk of osteoporosis, as well as excessive alcohol drinking. And then certain chronic medical conditions can increase your risk of osteoporosis, sometimes related to medications. And then a personal history of a fracture after the age 50. And if you have current low bone mass or osteopenia, that increases your risk for osteoporosis.
So the way that you find out if you have any of these conditions is by getting a bone density test. So it's a really quick and painless test. They basically look at your spine and your hip, and they assess your risk of fracture. It's the most accurate way to identify if you have one of these conditions. And then it also kind of tracks how well you're doing if you're already being treated for osteoporosis.
So it measures the content of your bones. So the greater the mineral content, then the denser and stronger your bones are. The most commonly used test is a dual energy X-ray absorptiometry. I cannot say that word. We just call it a DEXA scan. And the DEXA scan measures how dense those bones are and then gives you a score that we'll talk about shortly called a T-score, which reflects the density of your bones compared to the average bone density in a healthy young adult.
So not that you have to have any of these numbers memorized, but if we're looking at the report that we get after getting the DEXA scan, normal is when you have a T-score above -1, so more positive numbers. Osteopenia is when you have a score between -1 and -2.5, so like -1.5 would be in between there. It's kind of tricky sometimes. And then osteoporosis is when you have a T-score that is more negative than -2.5. And so a score of, it continues to kind of quantify that into mild, moderate, or severe osteoporosis.
So who should get these DEXA scans? All women by age 65 should have had one. If you're transitioning into menopause or in the early years of perimenopause and have other risk factors, if you've been taking medications such as glucocorticoids that are known to increase rates of bone loss, and then your doctor will recommend how often to undergo bone mineral density scanning based on your T-score, or other factors may play into this. After you get your initial DEXA scan.
So, the biggest and best thing that you can do is actually to prevent you from having excess bone loss. So these are some of the things that you can do to prevent osteoporosis. First is not smoking, or if you do smoke, you can actually improve your bone strength if you're able to cut down and quit smoking. So that is one of the things you can do. Also avoiding excessive alcohol use, having more than 2 alcoholic beverages a day negatively impacts your bone density and also does increase your risk of falling. So having a fracture and you may actually not have known that you had abnormal bone density. And then anything that you can do to prevent falls as we age, you are at a higher risk of having a fracture. And so things like making sure you're wearing non-slip shoes, make sure you have brightly lit hallways and things at night if you're someone who has to get up at night and go to the bathroom, things like that, and not leave clutter around things that you could trip over. So, easy things.
You can take calcium because about 50 to 70% of bone is made of calcium, and that's what gives it its strength. Getting enough calcium to keep your bone strong helps reduce the bone loss and lowers your risk of fractures. Women younger than the age of 50 should be taking about 1,000 milligrams a day, and older than 50 should be taking 1,200 a day. The preferred form of calcium is in your diet, but if you're not getting enough in your diet, then we want you to be taking a calcium supplement as well. And you can take it in split dosing too in the morning or evening. So looking up, how much calcium you're having in your different things that you're eating in your diet is helpful to know if you need to be taking supplemental calcium as well.
Some foods that are high in calcium include milk and dairy products like cottage cheese, yogurt, other hard cheeses, green vegetables that are listed here provide a good amount of calcium. So as much as that you can add into your diet. And then there are some foods that are fortified with calcium. So you can see that on the label of some fruit juices and then soy beverages as well.
Vitamin D also plays a key role in bone health. It helps protect your bones because it's required to help your body absorb calcium. So we need it to keep our bones strong and healthy. If you don't get enough vitamin D, you can lose bone, which will lower your bone mineral density and lead to increased risk of fractures as you age.
Some common sources of vitamin D, first is sunlight. So whenever you're exposed to direct sunlight, your body is going to make vitamin D. But we know that that also can increase your risk of skin cancer. So you don't want to go overboard with that. A lot of foods are also fortified with vitamin D, most milk and cereals. Additional things that you can do are egg yolks, some fatty fish like mackerel, salmon, tuna, and liver. And then vitamins and supplements as well. You can take too much vitamin D, and so you want to make sure that you talk with your doctor so that you're getting the right dose. You should be taking, when you're postmenopausal, it's 800 international units of vitamin D. So if you can kind of calculate how much you're getting diet and then see what you need for supplement.
And then exercising, like we talked about, weight bearing exercises and strength training. Weight bearing includes aerobic exercises with your feet, such as walking, running, dancing, tennis, elliptical, stair climbing. And then we recommend at least 150 minutes of aerobic exercise per week.
For strength training, this includes using free weights, weight machines, and resistance training. The goal is for you to do these strength training exercises 2 to 3 times a week. But you definitely should talk with your doctor or, again, a physical trainer before you get started to make sure that you're kind of gradually easing into it and not doing something that is unsafe for you, especially if you've already been diagnosed with osteopenia or osteoporosis.
So we'll talk a little bit about medications that help with bone loss. If you have been diagnosed with osteoporosis or have a history of fractures in your hips or your vertebrae, these are reasons that you might be prescribed medications to help strengthen your bones, to help reduce risk of breaking a bone or further fractures. There's also medications that can be prescribed during the phase of osteopenia or low bone mass to help your risk of developing a fracture or progression to osteoporosis. When you talk to your doctor about this, they'll take into account your health, how much bone loss you have, other medications or other health conditions.
These are some of the common medications that we use for bone loss. So bisphosphonates, and they all have a lot of funky names, but some of the brand names here you may be familiar with. Then raloxifene, calcitonin, and then these others, and additionally with estrogen hormone replacement therapy. We usually would not, like Dr. Hayden had mentioned, start that as a first-line treatment just for bone loss. But you can, continue to use it if you're using it for other menopausal symptoms.
Here are a list of questions to ask your healthcare provider at your appointment. So we went through a lot of these. How can you keep your osteoporosis from worsening? Do you need medications for your bone loss? How can I prevent fractures if you already have low bone mineral density or osteoporosis or osteopenia? How much calcium and vitamin D do you need, and how do I get those nutrients? So we talked about that as well. Exercises for bone strength. What exercises specifically are recommended? Is hormone replacement safe for preventing osteoporosis? We touched a little bit on that as well. Lifestyle changes that you can make to keep your bones strong. Should I have a bone density test? And if you've had one, what does my T-score mean? And then what additional resources of information do they have available to you? Should you have further questions or, need treatments that they maybe aren't doing right then? So this is just our resources.
Yeah. You guys have any questions?
Do we have any questions at this time from the entire presentation? Something that was on your mind before you even got on today? Go ahead and start putting that in the chat to me. And while we're waiting to see if we have any questions come through, the resources and the questions to ask your doctor, I am sending that to everyone as an attached PDF attachment so that you can actually have that. This is our last session, so I just want to thank everyone that has participated. Has been a part of several of our sessions. We did have quite a few repeats, and I appreciate you for that. If this is your first time, I appreciate you entrusting us with this information. We'll continue. I'll give you a few more seconds to see if anyone has a chat. But Doctors Higdon and Cisa, do you have any last thoughts that you would like to leave with the group? Something that they should, important for them to remember?
I think that, one thing that I feel like we see a lot is after women maybe have a hysterectomy or after they've gone through menopause, they sometimes will kind of either stop going or space out their annual exams with their doctor. And so a lot of times, if there are signs that you may be osteoporosis or, any other kind of health conditions, they get missed. And so, we don't want you to show up when you're, 70 per se, and haven't had a DEXA scan and we're kind of behind the 8 ball, so to speak, with making sure that you aren't losing too much bone and that kind of thing.
Yeah, preventative health is really important because, in addition to talking about osteoporosis, you can go over other things about menopause, which I feel like a lot of times when I see my women in the office, they may not even want to bring up some of the symptoms or problems that they're having until, we question them. So you may not even know that you need to ask a certain question until you go. So.
Excellent. So we didn't get any questions in the chat. So before we close out, I do have a disclaimer that I have to read to you. The information provided within these slides is intended for information purposes only. It is not a substitute for your professional medical advice or examination, and always seek advice of your clinician. Thanks to everyone that has participated, that has been on this session, Drs. Higdon and Dr. Cisa. Thank you so much for stepping in for Dr. Wanamaker. This has been recorded, and I will edit it and get it out to everyone that has actually registered. We do have some that weren't able to join us, although they registered. So we still would like to have them get that information as well. It's taking me longer to edit these as I want to, so please be patient and I will get these out to you. Thank you, everyone, and have a wonderful rest of the day and a wonderful holiday season.
Thank you, you too.
Bye-bye.